Okay, so let's talk about GLP-1s and breastfeeding. So are you a breastfeeding mom thinking about taking a weight loss drug like Tirzepatide? I'm a registered nurse and a breastfeeding specialist, and I like to share all things breastfeeding. I would like to preface this video by saying this is not medical advice, so please discuss this with your and your baby's provider before starting any new medication. So I'm just sharing general information that I found on Infants Risk website, so I'll share the link for that below. Okay, so I read this new article from Infant Risk Center, and there was a study that talked about the risks of Tirzepatide while breastfeeding, and the biggest concern is actually not what you would think. So first is the good news. The current research shows that Tirzepatide barely transfers into your milk, if at all, and that even if tiny amounts did, your baby would likely just digest it like any other protein. The article states that the medication itself is probably low risk when breastfeeding, but there is a concern with the medication and appetite suppression. So as we all know, this medication suppresses your appetite, like a lot. Like the studies actually show that this medication can decrease your calorie intake by like 40%. And that really matters because breastfeeding requires a lot more energy than normal, like 400 to 500 calories more a day. And if you're not eating enough, this could cause a low milk supply, nutritional deficiencies, dehydration, fatigue, and a host of other things. And that is actually the real concern with this medication and breastfeeding. So this article states that if you are breastfeeding a newborn up to 6 months, this is where it gets tricky because your baby is 100% reliant on your breast milk. But if you are breastfeeding an older baby who has already started solids, then the risk is much lower. So if you do talk to your provider and you do decide that this is the medication that you want to take, there are some things that they recommend. So they recommend eating small, frequent meals to make sure that you're getting enough calories, prioritizing your protein, staying super hydrated, and maybe at first counting your calories just to make sure that you're getting enough. So the bottom line is the issue is not really about the medication getting into your milk, but it's the side effect of the medication causing appetite suppression and making sure that your body still has what it needs to be able to feed your baby. Let me know if you found this interesting. Have you taken the medication while breastfeeding? What are your thoughts?